Welcome to the stage, so to speak, Dr. Amy Murray, researcher, Swansea University, and Professor Charles Musselwhite, Aberystwyth University. Amy is a research officer within CADA, who completed a PhD in gerontology and aging study in September 2019. Her PhD explored the process of driving cessation in later life among older adults and their informal network. Across her doctoral degree and beyond, Amy has undertaken work for the Campaign to End Loneliness, Welsh Government, the Older People's Commissioner for Wales, Living Streets, Get There Together, and the International Longevity Centre UK. Amy has subsequently developed international research links through her area of research expertise. Amy was awarded for her outstanding contribution to public engagement and was a winner of Researchers Art Award 2018. Welcome, Amy. Wonderful to have you here with us. I've also been told to introduce Charles at this point too. Professor Charles Musselwhite is the Chair of Psychology at Aberystwyth University. His research involves applying social, environment and health psychology to understanding improvement relationships between the built environment, health and well-being in particular. He is a global expert in travel and mobility and later life, including road use and safety, giving up driving, and creating age-friendly systems, neighbourhoods and communities. He's co-director of CADA and heads up Work Package 1 on the environment of ageing. I've had the pleasure of working with Professor Charles for probably a decade now, and it's been a wonderful working relationship. And I've always really enjoyed the stimulating conversations that I've had with Charles. And I know that in the question and answer session at the end of this, that Charles will pose a few questions that will get us all thinking. So welcome, Amy. It's a pleasure to have you here to talk about what makes an age-friendly environment.
Oh, good morning. Thank you very much, Daisy, for that lovely introduction. So I'd like to say good morning to everybody attending today. So as Daisy's already introduced me, I don't need to introduce myself again. But what I'd like to do today is just introduce to you our first CADA work package, which is Work Package 1, and that is Environments of Ageing. So the people who work on this particular work package are myself. I'm based at Swansea University as a researcher. There's Professor Charles Musselwhite, as Daisy said, who is now based at Aberystwyth University. And we've also got Dr. Ian Davis Abbott, who is at Bangor University. So when we're talking about environments of ageing, this is specifically defined as the term given to how the things around us, including buildings, roads and people, affect us differently as we age. And it also recognises that people can change or alter their environment too. So although the three of us I've just mentioned work primarily within Work Package 1, and those are our key main research interests, we do also work across the other three CADA work packages. So any researchers that you kind of see from CADA, we're normally chopping and changing between all four work packages. So we're not, specifically aligned to just one then. So what I'd like to do is just give you an overview of some of the work packages that myself, Charles and Ian are currently working on and have recently worked on. I won't go into absolutely everything because I may be here for the entire conference introducing things. So I'll give a brief overview of what we are currently working on. But while I'm doing that, if I could ask you as members of the audience to have a think about this next slide, because I will be asking you to use the chat function or the raise your hand function if you'd like to speak, to think about these three key questions really. So like I said earlier on in the chat, it's all, grand for me to sit here and say, this is what we're working on, this is what our research focus is. But what we really want to know is, what do you think may be missing from our current research? What would you like the focus to be? So 3 key questions to bear in mind, and please have a stab at these if you're willing to in the chat, like I said, or with the raise your hand function, is firstly, what is important to you in an age-friendly environment? That could be anything from making sure that the roads are safe, perhaps, in your local walking environment, to making sure there are access to public toilets, to feeling more socially connected to others, that sort of thing. That's just a few ideas. Where should and where could improvements be made? In terms of my work packages, I've worked on a number of aspects relating to environments of ageing, things such as the future of driving in the UK, looking at electric cars and driverless cars, looking at older people's experiences of winter last year through the COVID-19 pandemic. That was really interesting, looking at how neighbourhoods perhaps did or did not support people in Wales. I'm also working on a recent project called Living Streets, where we're looking at older people engaging in walking groups to try and avoid social isolation and loneliness, and to see what the positive impacts of joining walking groups are. So like I said, that's just an overview. What I'd like to do is to play you an animation, which is from CADA, and this animation will just give you an overview of what we basically do. So if I could just try and play that and still get you to have a think about the 3 key questions there, that would be great.
CADA studies environments of aging, looking at the physical and social environments that surround us as we age. Our research focuses on how such environments can be improved to help us stay connected to the things we want to do, enabling us to age healthily. Some areas CADA explores include older drivers and age-friendly transport systems, housing, neighbourhoods and communities, retail, mobility, health and care environments, workplaces, outdoor spaces, and sustainability and technology. Through our studies, CADA aims to create age-friendly and dementia-supportive environments, including those in health and social care, helping to prevent the risk of social exclusion by improving networks within communities allows all of us as we age to do the things we want to do and stay connected. Find out more. Get involved. Visit us at www.cadr.cymru.
Okay, so thank you for watching the short animation there relating to work package 1, environments of ageing. So what I would really like to do now is pick up some of the things that you've mentioned in the chat function relating to what you see as important for an age-friendly environment. So if I could invite Charles back here, and we'd like to pick up on a few of your discussion points. Please feel free as well to continue using the chat function while we're discussing some of these points, or raise your hand and get involved. So if I could just start with the first point there on the chat function. So that first point there is from Stephanie Green, and Stephanie has basically suggested more shared intergenerational spaces in the community that are developed with members of the community. So that is a very important point, and there's lots going on around intergenerational research at the moment, where we're looking at basically different generations coming together to include older people, really. So they're often a focal point of research or living. You may see multiple generations living together, that sort of thing. But that is a really good suggestion there. And I know that Stephanie and other people at Swansea University are currently working on intergenerational research projects. So that is a fantastic idea. If anyone has any ideas of how we may push that agenda forward, because research is evident that intergenerational spaces and practices do help to reduce loneliness, and they improve older people's well-being. So I don't know, Charles, if you've got any thoughts on that too?
Absolutely. I mean, it relates, perhaps all researchers always think it relates to their research, but it does relate a little bit to what I'm going to talk about in a minute in terms of, being a pedestrian in the built environment, because it's probably fairly recently that in the last sort of 30 or 40 years, we've created our environments more and more around the car. So there's less room and less space to walk and to be connected to the communities that we live within. And again, there's a lot of people, perhaps we work harder than ever before, perhaps we travel further for work than ever before. And we've created a lot of communities that are a bit like dormitory places, or, places where people just come home and sleep. They don't do their recreation there, they don't do their work there. There might not even be that many schools in that area anymore. So the private car has given us all these opportunities to travel further, but at the expense perhaps of a lack of richness, if you like, in our local communities. And that would have been space that traditionally would have been a natural coming together of people in intergenerational ways. So people would have come from all different walks of life, all different backgrounds, walking to work or walking to the local cafe or walking the kids to school, along with older people in the community, and everybody would have come together. And I think that, we perhaps it's rose tinted glasses a little bit, but there would have been more of a sense of community in a lot of places. And perhaps we saw a little bit of that in the pandemic. And I know some of your work, Amy, talking to older people during lockdowns and things like that, and how perhaps we had two very distinct groups of older people: those who got more involved in their community than ever before and felt more connected to local people, and those who felt more isolated and more lonely than ever before. And some of that was around the community that was around them and the support that they got. So in the intergenerational bit of that is really important for people to learn off each other or to chat to each other. So all the older people don't think youths are hooded hooligans, and all the young people don't think old people are boring and haven't got a place in society. You've got to create more space for people just to come together, I suppose.
Definitely. And I know lots of other people, Eleanor Shaw there at PSU, you've suggested that all community work should be intergenerational. I totally agree. Natasha Harris has agreed there. And Carol Beaumont. So I know Carol won't mind me saying, Carol was one of my research participants on the Winter Stories project. And Carol has basically said that it's important to keep in touch with neighbours, especially if you live alone, and there need to be more community centres. And I totally agree, Carol. And Carol was fundamental to that project, really, talking about her experiences of living in a housing association there in Newport. And I know that Carol will have lots of thoughts on how we may, keep in touch with our neighbours, especially if you're living alone, like you said, and what the value of community centres are. So I do know that we are running a little bit short of time here. So if we can keep using the chat function and raise your hand function there and keep the discussion going, we can pick this up at a later point. And we've also got a question and answer session at the end here. And also myself and Charles can share our email addresses. So if anybody would like to contact us directly as well, we're more than happy to have a chat about things, either, within if there's time in the conference or afterwards then. So thank you all so much for participating there, and your messages will not be ignored, and we'll go back to them in a moment then.